Welcome to This Explainer. If you're tuning in, there's a really good chance you're a parent whose child has recently been diagnosed with ADHD. First of all, I just want to say, take a deep breath. Navigating a brand new diagnosis and all the treatment options that follow can feel incredibly overwhelming, right? Especially when the conversation turns to medication. You probably have a million questions and for sure a few worries, and I want you to know that is completely normal. My goal today is to walk you through the science, the facts, and the medical consensus, really to help transform that apprehension into confidence. So here's our game plan for today. We'll start by exploring the medical consensus. Then we'll break down exactly how the medication works. After that, we'll look at what better focus actually looks like in the classroom, how to navigate some common side effects, and finally, we'll talk about reducing long-term risks. Let's jump right into Section 1, exploring the medical consensus. To start us off, the World Federation of ADHD released an international consensus statement, and this was based on massive, global systematic reviews and meta-analyses. Their conclusion? They stated that the primary medication used to treat ADHD, which is generically known as methylphenidate, is safe and among the most efficacious drugs in all of medicine. When you're making a big decision for your kid, knowing that the medication is recognized this highly by international experts really provides a strong foundational layer of trust. And hey, this isn't just one organization's opinion. We are talking about unanimous professional endorsements here. Think about the American Academy of Pediatrics, the World Health Organization, the FDA in the US, the European Medicines Agency, and the UK's National Institute for Health and Care Excellence. All of these major medical and regulatory bodies have extensively reviewed the safety and efficacy data, and they unanimously conclude that this is a safe, highly effective first-line treatment for ADHD. You're not experimenting here. You're following the absolute most heavily vetted medical guidance available. Moving on to Section 2, how the medication works. Okay, so the medication is what we call an NDRI. Now, that stands for norepinephrine dopamine reuptake inhibitor. I know that sounds highly technical, but let's break it down into plain English. In a brain with ADHD, there are functional impairments in the specific pathways that use dopamine and norepinephrine, which are basically the brain's natural focus and reward chemicals. The medication acts as a blocker. Think of it kind of like putting a stopper in a sink. It literally stops the brain from draining away these chemicals too quickly, which helps your child's brain hold onto its own natural focus. So, in practical terms, here is how it plays out. Step 1, the medication halts that reuptake process we just talked about. Step 2, because they aren't being swept away so incredibly fast, the levels of dopamine and norepinephrine start to rise in the synapse, which is the gap between neurons. And Step 3, as those levels rise, the central nervous system experiences a real increase in alertness and concentration. It effectively bridges the functional impairments in areas like the prefrontal cortex, which reduces mental fatigue and really improves attention. All right, Section 3, better focus in the classroom. So what does this actually look like during a typical school day? Teachers often observe specific improvements that we collectively call enhanced executive functions. You'll see better working memory, meaning your child can hold instructions in their head long enough to actually complete them. You'll also see improved sustained attention, which allows them to stick with a lesson. But maybe most importantly, you'll see increased inhibitory control. This means they gain that absolutely crucial split-second ability to stop themselves before acting. And that leads to noticeably reduced hyperactivity and decreased impulsive behavior. To put it into perspective, without medication, a child with ADHD struggles immensely with tedious tasks. It's actually physically uncomfortable for their brain to sustain focus on something they find boring. But with biochemical support, what researchers call task saliency and arousal increases, it suddenly makes those difficult school tasks far more manageable. The child finally has the internal biochemical support they need to show the world just how smart and capable they truly are. Let's shift gears a bit for Section 4, navigating common side effects. We absolutely need to talk about side effects because your concerns as a parent are 100% valid. When looking out for these in the gastrointestinal category, appetite loss and weight loss are very common. In the nervous system, you might see trouble sleeping, some anxiety, or maybe irritability. And on the cardiac side, there can be mild increases in heart rate and blood pressure. We definitely aren't hiding the downsides here. These are real effects, and it's important to be aware of them. I also want to address a very specific concern a lot of parents have, and that is growth. The data does show there can be a mild reduction in height with prolonged treatment in children. But how much are we actually talking about? Well, it's estimated at a maximum of just 1 single centimeter, or about zero point 0.4 inches per year during the first 3 years of treatment. Having a specific number like that often helps put the actual risk into perspective. Ultimately, the takeaway when it comes to side effects is not to panic, but just to observe. Because some adverse effects can emerge during long-term use, constant vigilance is recommended. But remember, you are not alone in this. You are part of a continuous monitoring team with your medical provider. If a side effect pops up, you simply work with your doctor to adjust the dose or the timing to manage it effectively. Which brings us to Section 5, reducing long-term risks. This is where things get really profound. When a child's impulsivity and inattention go untreated, the long-term snowball effects can be severe. However, the international consensus statement shows that long-term medication treatment substantially reduces massive life-altering risks. We are literally talking about reducing educational underachievement, lowering the risk of substance abuse and smoking, and reducing rates of depression and suicide. It even significantly lowers the risk of accidental injuries, traumatic brain injury, and future criminal activity. By giving them the ability to pause and focus today, you are actively protecting their entire future. And if you're worrying about what this does to a growing brain over the years, well, the data is actually incredibly reassuring. Long-term meta-analysis show that ADHD medications are not associated with deficits in brain structure. In fact, they're associated with improved brain development and functioning, particularly in the exact regions of the brain responsible for control and attention. It's like the medication acts as scaffolding, helping the brain to develop more normally. So, that brings us to our final thought. Are you ready to support your child's journey? We've seen the overwhelming global medical consensus. We understand how it gently supports their natural brain chemistry. We've reviewed the honest side effects to watch out for, and we've seen the incredible long-term protection it offers. Reframing this treatment as a powerful, evidence-backed tool changes everything. But remember, the medication is just the scaffolding. The real magic is what your child builds with it. So what untapped potential might your child finally unleash when their brain gets the support it actually needs?